Hi, good evening to everyone. I'm Dr. Philip McMillan, and today I am picking up on this international story. Was Joe Biden taken out by COVID, in the sense that was this the critical factor that made him step down? So the whole world was brought up to date in the past few days. This is all about the US election and what is happening in the next few months. But I am going to be showing you some important clips, and I've got this because I appreciate this information so much. This is from Simon Iteba. So he is a chief White House correspondent, Today News for Africa. And what I like is that he brings us really cutting edge, up to date news, and he keeps it on his profile. So I was able to step back from his profile and take a look at the timeline as to what happened over the past few days and make some analysis. Listen, a lot of people think COVID is no big deal. And truthfully, for many younger, healthy people with good immune systems, especially mucosal immunity, it's no major factor. But what I am explaining to people is that this, every time there is a reinfection, especially in vulnerable people, I have predicted this spike triggered autoimmune response mechanism storm. And in effect, what I am thinking is, I don't know for certain, but did Joe Biden have what I would call a brainstorm? Everybody's looking for the lungs. But if the immune system kicks in and causes inflammation, it can present in a wide variety of ways. And that's the important point, is that that's what we need to understand. It's a pity that he didn't listen to my information from my ebook. And this is what I want you to do. First, make sure you've subscribed if you're on YouTube. Otherwise, please follow me. But critically, we have put together a whole short book on nitric oxide and the sinuses. And the reason I've put this together is because this region, if you protect the sinuses from infection, that's the sinuses and the nasopharyngeal region, it reduces significantly the risk that the virus will penetrate your mucosal immunity and cause systemic symptoms. And what we have been explaining to people is the science around using humming to increase the nitric oxide. Now, for many people, they've never heard of this. And this is a short ebook in combination with Lumientia. And what you have to look at, it's only 30 pages long, and in it, we explain all those principles. What is nitric oxide? How is it related to the sinuses? Its role in health, breathing exercises, and nitric oxide. This is a no brainer. And so, in order to get this, please, it's very simple. Just go to the landing page and register. Sign up for a newsletter. It's free, there's nothing to lose. Read it, share it with your friends. Make sure that, in effect, you can help others simply by understanding the science. That's all we want you to do. Understand it, explain it. Maybe if Joe Biden was aware of this and he was doing this, this could have probably helped him in all his travels, because he was very exposed moving around to all these presentations. So let's get back to the question. What am I talking about when I say brainstorm? And this is taken from my recent presentation about storm. So this is a few of the slides. If you want it, the link is in the description as well. What I explained is that in the context of the spike triggered autoimmune response mechanism, that's what I call the storm, you can have inflammation of the choroid plexus in the brain. I'll show you a quick picture as to what that is, and the blood brain barrier. If you get inflammation in the brain or even in the brain stem, it can cause all kinds of strange neuropathies that can affect especially older people. Really comes with a whole range of symptoms. And what I've been highlighting is this choroid plexus here. This is the blood supply that produces the CSF, the fluid that circulates through the brain. What I'm anticipating is that this area, very immunologically active, and if this becomes inflamed, it can cause symptoms, especially in the elderly. And this is what you can have: all kinds of symptoms: spinal cord inflammation, headaches, confusion, encephalopathy, seizures, stroke. And my suspicion is that what may have happened to Joe Biden is this region here in terms of confusion, because the trajectory with regards to his decision was so quick. So, what I'm going to do is I'm going to take you through what that trajectory was. And again, I give credit to Simon and Tabor for showing this information and allowing me to analyze it in a hopefully logical way. So, the first thing that I want to show you, and I think I'll have to use my other screen here because I want you to hear the sound. And in order for you to get what I'm showing you, I'll try and see if you can get the sound. So this is the same information here. And I'll put it there. And I'll let you listen to Joe Biden just 5 days before he made this decision. This is him.
Understand, if you're going to talk about standing against violence, you must stand against all violence. You must stand against violence perpetrated against presidential candidates in Pennsylvania. You must stand against all violence. The violence perpetrated against George Floyd in Minnesota, against black veterans like police officers Eugene Goodman on January 6th, and black election workers like Ruby Freeman and Shane Moss in Atlanta. You have to stand against the violence and intimidation of white supremacy, the murder, innocent lives in that grocery store in Buffalo, New York when I went up there. Mother Emanuel Church in Charleston, South Carolina. Was standing against the violence that murdered children in Sandy Hook and Uvalde. Concert goers in Las Vegas. Innocents on the street all across America.
It's important to note here, and I'll just pause this temporarily, is that this was 5 days before this announcement came. And so this is why I'm very interested in. So this is 5 days. And quite truthfully, at this point, Joe Biden sounds pretty okay. And that's what I'm saying is when I think about it, at that point, Joe Biden sounds all right. This is 5 days ago, okay? That's the first point. So at this stage, the reality, he would have been exposed already to COVID. He may not have started having symptoms, but based on the timeline, because usually the person gets infected, it takes at least 48 hours for the virus to replicate enough, then to start spreading, and then to break through the mucosal barrier. So it suggests that he would have been infected at this point, but largely asymptomatic. This is how a lot of people are, and it appears that the infection comes on quite suddenly. So then the next day, so that was day 5. And then we have an image here on day 4. So this is 4 days ago now. At this point, Joe Biden is walking up on the plane. He looks as though he's struggling at this point. And this is when the diagnosis had been made with regards to COVID. So it's just been made at that point. So that's 4 days ago. And they were doing that because they were demonstrating that he was managing okay. And he was still continuing along with presidential business. He had minor symptoms and he was moving along. Then, still 4 days ago, because then the question has been coming, is he going to step down? Is he going to step down? But at that point, why would he step down? He just has a case of mild COVID, and he would just continue along. And that's exactly what he said. And this is, again, Simon showing us this. Now, you can't quite read this, but essentially what it's saying here is the Biden campaign states that he's staying in the race and not going anywhere. So President Biden, at that point, he was under pressure to bow out, and he, from Pelosi, from Schumer, from Jeffries, but no, our campaign is not working through any scenarios where President Biden is not at the top of the ticket. That's 4 days ago, okay? So that's the timeline so far. Then we have happening now 2 days ago, And so today is Monday. So this would have been about Saturday, Friday, Saturday, that this would have happened. You then have this letter come out. And this is from, and again, you may struggle to see this because it's too small, but I'll explain it. So it was from Kenneth O'Connor, which is the physician to the president. And he was giving a COVID update on the patient, on President Biden. He had just completed his fourth dose of Paxlovid that morning. He had a loose, non productive cough and hoarseness as his primary symptoms, but they had improved meaningfully from yesterday. And all his other observations were absolutely normal, as well as his oxygen saturations. And they again confirmed that he was still positive and the blood work was essentially normal. The president continues to tolerate treatment well, and they will continue with Paxlovid as planned in the meantime, and he will continue to do the work of the American people. Wonderful. So this must have been around Friday because they would have put out the letter by Saturday so that people are reassured. The press would have something to deal with. And that was where things were. So this would have, as I said, been around the 19th. And it is no surprise that as well, on the 19th of July here, for immediate release, it was released on the 18th, he had cancelled all of his press schedule for that Friday. He probably wasn't feeling so great. One of the main symptoms that you will find in older people is that they will tend to get quite fatigued and they'll feel quite tired. And it's not surprising, especially if he had a reduced schedule, that he would have been a bit more tired and therefore just canceled the schedule. It makes perfect sense. One of the things you have to take into consideration is both presidential candidates, well, the president and the Republican candidates, are over 75 years old. They are not as young as they were. And I think people need to take that into consideration. When we see patients in their 80s and they have things happen to them, it's not a surprise from a clinical point of view. It's almost expected. And so, therefore, for people to have an unrealistic expectation as to how somebody is going to perform in terms of their activities when they have COVID or anything else, I think that that is not necessarily fair. So, on the 21st, I remember Friday, it was the canceling of the press conference. Saturday, he was not probably doing anything. But now, by Sunday, and again, you probably can't read this. I wish I could get this bigger. This is now where he has stepped down. He's talking about the progress that the nation has made in 3.5 years. It's the strongest economy in the world, historic investments. And then down here, he jumps to, he says, it's the greatest honor of my life to serve as president. And whilst it has been my intention to seek re-election, I believe it is in the best interest of the party and the country for me to stand down and to focus solely on fulfilling my duties as president for the remainder of my term. He will then update us with regards to his decision later in the week. So you notice this is a letter. And the reason I think that's important, because this is such an important piece of information, most people would do this publicly. It wouldn't come as a letter. They would go in front of the podium and they would say, listen, I think that it is time, da, da, da. And that would come across better. But he didn't do that. And not only did he not do that, he still hasn't done it yet. This is Monday. I suspect we will not hear a statement until much later in the week. And the reason for that, I suspect, is because I think the immune part of the storm, the inflammatory process that can affect the brain, can often cause what we call a delirium. So, in patients, older patients who have mild cognitive impairment, where you get a bit forgetful as you get older, the brain shrinks a bit. So, if I had looked at a CT scan, that's what I'd expect to see. It's not surprising that somebody over the age of 80 could have a short episode of delirium where they get confused. Now, that's purely speculation because I don't know for certain. However, that would explain logically in my mind why he didn't give a statement, because that would be what would be expected for such a significant announcement. But the point of all of this is simple. When we think about COVID, people keep on thinking this is a respiratory disease. It presented as severe COVID 19 as a cytokine storm. And the cytokine storm caused inflammation in the blood vessels, which led to blood clots, and people couldn't breathe and therefore they could die. But the question is, can that cytokine storm affect other organs? What happens if it affects the kidneys or the heart, or in this case, potentially the brain? How does it present? How do we identify it? How do we manage it? If it is significant enough to cause the president to change his perspective within 3 days, remember, he was not planning, he pushed away all the concerns that he should step down 5 days ago. But 2 days ago, he steps down. And what was the common denominator? It was COVID. And I suspect this is likely to keep him out of the public eye, and this would therefore make it even more difficult to be able to campaign. That's the reality. Here is the problem as we go forward. For many people who continue to ignore this concept, spike triggered autoimmune response mechanism, who keep on looking for respiratory disease and thinking that if you don't see respiratory disease, there is no problem. What it means is that you're going to miss clinical presentations that are relevant. And critically, what we're not therefore doing is identifying ways to treat what I think is a storm. Because even if we have a cytokine storm with inflammation happening in the brain secondary to COVID, what do we do about it? Do we just leave it? If the president of the US doesn't have a clear way of it being managed, can you imagine what would be the case for your grandparents or your parents if they are over the age of 70 or 75? How do we do that? Delirium is not something to be underestimated, you know. Delirium, and again, I'll show you this here, this manifestation of the brainstorm. What technically I'm talking about with confusion is the delirium or this encephalopathy. In a third of patients, up to a third, they can technically move from being functioning normal with very mild forgetfulness to having what appears to be moderate dementia within weeks, and it doesn't change. It is not to be underestimated, delirium. And this is the point, is that we need better mechanisms to be able to understand the storm. As I said, if this can affect the president of the USA, it can affect anyone. And we need to find answers so that it doesn't impact so many people. It is sad for what has happened with Joe Biden because he looked as though he was determined to make sure that the Democrats under his leadership would stand up to the Republicans through Donald Trump. So the same two were going together. It is sad if purely because of underestimating COVID, this is now unable for him to be carried through that desire and dream that he would have had to make things better. Now, this is therefore a risk for everyone. But yet everybody is going around thinking that there is no problem. What happens if other people get COVID and it impacts their ability to function? That is pretty serious because it will affect every aspect of our lives. So my main point is, remember, if you want to understand about the power of no, please just subscribe to our newsletter. You'll get all the information that you need. These are the contents, the science behind what is going on, and how you can help others through nitric oxide to reduce the risk of infection and protect the body generally. Nitric oxide is a critically important molecule that the body uses in everything. So please join our journey in terms of science, and maybe if I can share this information with Joe Biden, it could be of relevance to him as well. So have a great evening. Look forward to sharing more information in the near future.